So guys, Kim Kardashian just posted about using a tanning bed, and we need to talk about why that's a huge problem. With millions of followers, promoting something like this is not just concerning, it's dangerous. Hi, I'm Dr. Weinstein. I'm a board-certified dermatologist, and today we're going to break down why tanning beds are the worst thing you can do for your skin, especially when someone with such a huge platform is endorsing them. So let's get real. Tanning beds are not just about getting a glow. They're directly linked to skin cancer, accelerated aging, and irreversible damage. In fact, using a tanning bed before the age of 35 increases your risk of developing melanoma, the deadliest form of skin cancer, by 75%. And no, that's not just a scare tactic, that's science. And that risk increases with each use. Just a quick fact, nearly 70% of people visiting tanning salons tend to be Caucasian girls and young women, and melanoma is the second most common cancer overall in women ages 15 through 29. Indoor tanning equipment emits both UVA and UVB radiation. The amount of radiation produced during indoor tanning is similar to that of the sun, but in some cases it can be stronger. Several studies have shown that exposure to indoor tanning can not only increase the risk of melanoma, but it can increase the risk of other non-melanoma skin cancers like squamous cell and basal cell skin cancers. And we know from research that exposure to UV increases the risk of melanoma, whether you're getting it from the sun or indoor tanning. But something else that can happen is that the risk of a normal mole progressing to melanoma is even higher. Not only can excessive exposure to indoor tanning and UV radiation increase the risk of skin cancer, it can also lead to premature skin aging, immune suppression, and significant ocular damage, like an early onset development of cataracts or even ocular melanoma. So when someone with as much of an influence as Kim Kardashian posts about going to a tanning salon, it normalizes something that dermatologists have been warning about for years. Her audience includes young, impressionable women that think, hey, if Kim does it, it must be okay. Spoiler alert, it's not. It's so disappointing and frustrating, honestly, because with her influence, she could be promoting much safer things like self-tanning products or spray tans that don't put your skin at risk. So if you love that bronzed look, here are some dermatologist-approved alternatives: self-tanners, bronzing drops, and professional spray tans that don't involve UV light. So you might be asking yourself, hey, I've been indoor tanning a few times and I do have quite a few moles. What should I do, or how do I know if I'm developing skin cancer? Well, the first thing you should do is, if you see a suspicious spot on your body, call your dermatologist or your primary care doctor to get in for a spot check. A spot check, yes, that is a thing. If there is a suspicious spot on your body, we can take a look pretty quickly. Now with the advent of telemedicine and e-consults, it might be as easy as snapping a photo and sending it into the office. So it's worthwhile if you notice a spot that's been changing or looks a little funny on your skin, maybe it's been bleeding or itching, send a picture to your dermatologist or your primary care physician so they can point you in the right direction. Also, embracing your natural skin tone and focusing on overall skin health is going to be best for that long-lasting glow. At the end of the day, trends come and go, celebrities influence and then don't, but your skin is with you for life. Protect it. Let me know what you think in the comments below. Should influencers be held accountable for promoting harmful beauty trends? Now, when diagnosing melanoma, there are specific things that we ask you to look for at home, and the mnemonic we live by as dermatologists is called the ABCDEs of melanoma. So A stands for asymmetry. If your mole does not look the same on both sides, if you were to slice it in half, that means it's becoming asymmetric, and that could be a concerning sign. B stands for border. So if the borders are irregular or jagged, or look kind of like a puzzle piece, then this could be a sign that your mole is changing and it should be looked at a little bit closer. C is color. So most moles are brown, black, or somewhere in between, but if your mole looks brown and black, or is spotted, or maybe it lost color in an area and the color is not uniform, or maybe it's red or skin colored, that's a reason to come in for a check. The last two things have to do with size, so diameter. So if your mole is larger than the size of a pencil eraser, which is about 6 millimeters, then that's again reason for concern If it's growing, changing, evolving in any way, that's reason to come in and see your dermatologist. Typically, we'd take a look, we'd use our dermatoscope, and it should be pretty simple to tell if it's something concerning. If it is concerning, then we would offer a biopsy, which involves taking that piece of skin, sending it to the lab, and having a doctor called a dermatopathologist look at the tissue under the microscope to make the appropriate diagnosis. Now, hopefully it's just nothing, but if it is something, then you did your due diligence and caught it early by doing a monthly self-skin check and making sure that you're not missing anything that might be changing on your skin. So dermatologists use tools like dermatoscopes to look more closely at spots on the skin. Don't forget to like, subscribe, and share this with someone who you think needs to hear it.